Welcome back to the show. So, if you're a listener to this podcast, I'm not going to bore you with all the details of the recent approval of Aducanumab by Biogen and its partners Eisai. I just want to kind of summarize the events before I tell you why and what I am excited about. And it's probably not what you think. Welcome to the Evolving Past Alzheimer's podcast, where we are focused on bringing you information to help prevent from developing and improve from suffering with brain diseases like Alzheimer's and other dementias. I'm Dr. Nate Bergman, a physician and Chief Scientific Wellness Officer at Kemper Cognitive Wellness, and I'll be your guide on these sound waves. So whether you're a baby boomer who's worried that your brain wiring just isn't working like it once was, or you have a loved one with the disease, or you yourself have already been diagnosed and are wondering, what do I do now? You'll want to listen to this podcast. Each episode, we introduce you to the top doers and thinkers that are revisioning Alzheimer's, dementia, and just generally things in life's second half. If you have questions or comments, check us out on social media. To support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show if you find these episodes valuable. That's Patreon, Patreon, patreon.com/evolvingpast. So here we go. Let's get better. So as you guys all know, it's been 18 years, long years, since the last medication has been approved for Alzheimer's. But a couple months ago, June 7th, 2021, the FDA gave something called an accelerated approval to Biogen's novel medication, Aducanumab, or as it's known, Aduhelm. We had Dr. Marwan Sabag on the podcast a couple episodes ago, and it's really good. I mean, he presents a very pro-medication, pro-approval, and he has been very outspoken and very public in his non-opposition, right? And he deals with it. And so I would invite you to listen to that episode because he really articulates a side that's important that doesn't seem to be being heard here. But just for those of you that may have not heard, although you probably all have, all my listeners have at least, the FDA's accelerated approval pathway is given to drugs that show promise, right? But that approval is provisional, right? So in other words, it's contingent on further verification that the medication will work, right? And in this case, they have apparently like a 9-year window to see if it still works. And this is what the FDA does from time to time when there are no other drugs that work for a disease. And Alzheimer's is certainly in that category. Right. So what happened in this case is that the two big trials, Emerge and Engage, they were called. Each one was a phase 3 clinical trial. So that's the last phase that you need before you can submit to the FDA to really get a full approval and begin to use a medication outside of a research setting. Right. And so there are two of them. Usually need 2 positive trials to get an approval. And what happened is that one of the trials, called Emerge, showed a very small improvement, and the kind of improvement we're talking about was 3%, 2 to 3% over what the drug maker previously drew as a line in the sand as what they call the line of futility, right? So meaning it just barely slowed down the participants of the trial that had the highest dose, right? So it may have slowed down a little bit the cognitive impairment just above its predefined line of futility, meaning if it didn't cross that 20% threshold, then they would have just sacked the whole project, which they actually did in 2020 in March of 2019 until they reopened it later in the fall of that year. So the Engage trial, the other big trial that had 1,600 people in it, and these are big, expensive, hard to do trials. I mean, these are impressive things if you've ever been around one or been part of one. But that Engage trial did not show any significant improvement above where the placebo was, really. So when you just kind of sum it up, you think, well, other than that, it's not really clear whether Aducanumab, this new medication, actually slows down Alzheimer's. And even at that, at the highest dose it's tested, other than the fact that 3 of the FDA's appointed kind of crack crew advisory team, 3 out of 11, resigned so as not to be even affiliated with this approval. And besides the fact that nearly 40% of people had side effects, although, to be fair, those side effects did seem quite manageable. And if this drug really worked, I think all of us would take the drug if we had Alzheimer's and probably not deal with the side effects, although I can't speak for everybody. But 40%, nearly 40% of people did have side effects. But it was the cost, right? When they, as you guys all know, when the $56,000 a year cost for the drug alone, just the drug by itself, was announced, that's when things kind of erupted, because in addition to the cost of the medication, you need the cost of the infusion center and some of the imaging and some of the diagnostics, all sort of continue to add for it's just to add up to sort of an astronomical cost for something that doesn't really have clear evidence that it works, right? So if you read the stories in major news outlets, and I'm not talking about having to resort to go to the far corners of the internet where conspiracies are sort of thrown around on a daily basis, but I'm talking about the major news outlets. The way I read the current spin on what's happening with aducanumab and Alzheimer's is that between the FDA and pharmaceutical companies, who, to their credit, I guess, to some degree, they've invested millions and in billions of dollars. If you listen to Dr. Sabag's interview with us a couple of weeks ago. But I mean, there's this sort of nexus or partnership between FDA, pharmaceutical companies, and then institutions that are doing these drug trials, and then of course, and probably most importantly, the patients, like people that have Alzheimer's themselves. They collect the collective voice that has been a voice in the ear of legislators for a long time is we need an approval. We need a win, right? We need something to hope for. We want other drug companies to get in this fight and develop something. If we don't approve it, we're not going to get a win. Now, that's a very arguable line. That's a very arguable line, and it seems like for the most part, in terms of who we're talking to, most people have sort of backed off and said, "Hey, this drug doesn't sound like the real thing." Although I guess we'll see. And already we have many other compounds that are making their way in the next year or two that are similar. Biogen themselves has one of them that seem to be pretty close to requesting approval as well. So places like my old stomping grounds at the Cleveland Clinic and others, Mount Sinai and others, are now saying they won't prescribe this drug. They won't offer it there because of basically the lack of data and the tremendous costs involved. And I did speak to a couple of people over at the Cleveland Clinic that may have been a prescriber, and a number of them were very proud that they weren't going to be prescribing this. So there we have it. I mean, that's what it is. No real clear evidence that you'd like that cognitive decline is slowed by aducanumab. And so why did I say I was excited about it, right? And there were two reasons. First is it's waking people up to the fact that there may actually be something you can do to slow down Alzheimer's. Right? For so long, the case was there's nothing you can do. We all know there's nothing you can do. We'll just let dad or mom or my husband, my wife, whoever it would be, continue to decline because there's nothing you can do. So we'll just wait until we have to take the keys away instead of making a big deal out of it and go to the doctors. The doctors say, just getting older, it's just stress, that kind of thing. But the first thing is it's waking people up to the fact that there may be something you can do. Second thing that I'm excited about in terms of the context of what's going on here with aducanumab is that the approval and then this sort of narrowing of the approval, which is this group that was studied in the two big clinical trials that were at issue that we mentioned at the beginning, Engage and Emerge, they really were only pointed at people with mild cognitive impairment or very early Alzheimer's disease, right? And if you know anything about cancer, right, the earlier the better. Stage 1, stage 2, right? We want to get it before it starts to spread. And mild cognitive impairment even is almost like a stage 3 cancer. Alzheimer's spreading, right? It's been around for a while. So what this aducanumab trial is starting to let people know about is that in order to be maximally effective, we need to treat earlier, right? Everybody we treat, where I am at Kemper Cognitive Wellness, everything we've talked about on this podcast for so long is trying to get it earlier, right? It's trying to get it earlier. So the idea that that you can do something was the first thing I'm excited about. And secondly, that the idea, the notion that we need to treat early and to identify early is critical here. So I'm thankful for the news and the coverage of aducanumab, because enough people that have an interest in this or have a need for this or are paralyzed by fear every time they forget something because they now have copies of ApoE4 and they know that their mom or parents or both had some level of Alzheimer's or dementia. And so the idea that we can do something about it earlier. If you listen to some of the previous episodes, the last 3 out of the last 4 episodes are about evidence for and people being studied and our own patient getting better with cognitive decline. So the last thing I just want to say is if any of our listeners have tried this medication, meaning they're a part of a clinical trial, and they would like to come on to talk about their experience with it, we'd love to have you on and discuss your experience. So there you have it. We'll talk to you again real soon. Thanks for listening.
So that's our episode. I hope it was useful to you. Check out the show notes on iTunes or on our website where we've summarized the key points. If you find the information here valuable, please consider giving us a 5-star rating on iTunes and leaving comments in the comments section. It will really help us bring this message to as many people as we can. If you have questions or comments, connect with us on social media. Finally, to support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show. That's Patreon, Patreon, patreon.com/evolvingpast. Thanks, and talk to you next time.